Back to the Frank and Lizzie show. Today I'm in clinic and we're going to be talking about compression, but we're not going to talk about compression pressures or even dosages. We're going to talk about the different types of compression options, their materials, devices, and systems that we can use with our patients. Compression is not a one-size-fits-all. The right compression depends on multiple things. The patient's limb, the shape of the limb, the tissue, the amount of swelling, can they apply it, and actually more important, can they actually use it? Short stretch, they have a low resting pressure and a high working pressure, and we're going to use these in the beginning phases in what we call the intensive phase. We want to decongest the extremity before we put a garment on. The next is circular knit. So this is another kind of garment that we have. Garment is made like a seamless tube, and it comes in a variety of styles. They're often lightweight, flexible, and easy for many patients to wear. For patients with a relative regular limb shape and less complicated swelling, circular knit can be your option. We also have flat knit garment, so there's a difference, okay? Flat knit has a different construction and generally provides more structure and containment. These are great for patients that have a large limb circumference. Maybe they have lobules, maybe they have skin folds. Sometimes you have other problems, but these are custom fit. And remember that flat knit automatically is not better than circular knit, but the patient's presentations determine the right garment that we can use for our patients. Now, we also have Velcro or adjustable wraps. These are wonderful, especially if patients are not able to apply the other kind of garments, but keep in mind you have to readjust throughout the day. In addition to that, we also have some Velcro, but also have air that we can use, and we can preset how much compression we want on our patient. We also have tubular compression, and so this is what it looks like. Now, it looks just like a sock, but it's made out of tubular compression material. They're simply easy to put on, they're stretchy. They can be useful in certain situations, but remember, just because something is tubular doesn't mean it's equivalent to medical grade compression. And so understand how much compression you're providing with every product that you are using. And also, we have nighttime garments. And so if they're using a garment like a flat knit or a circular knit, they have to take that off. And at night, they can wear a sleeve like this that's measured to them, and it can provide compression at night while they're sleeping. Compression selection should be individualized. Many choices. If you're living with lymphedema and you're not sure which type of compression is right for you, talk with your lymphedema therapist or healthcare provider.